Hi, Casey. How are you?
Hi, doctor. I'm pretty good. Thank you for asking.
Wonderful. First, can I verify your first and last name and date of birth?
Yep, it is Kate C. ASMR.
Perfect.
And it's March 12th, 1997.
Beautiful. And you're here for a 7 p.m. appointment. You have our last slot of the day. Okay. So you haven't seen me in about a year. So I'm assuming you want to do a full head-to-toe exam, cranial nerve.
Yeah, whatever you think is necessary, whatever is routine. I did have some slight headaches that have been bothering me.
Okay.
And a little bit of back pain, but I think just wanted to mention while I was here.
Okay. Do the headaches and back pain coincide? Do they happen at the same time, or are they different?
No, I can tell if the back pain is from just poor posture on my end, because there was no injury or anything. It's just kind of been I feel the need to stretch a lot.
Tension and tightness in the area. Which side of the back?
It's pretty in the middle, just lower back pain.
Center, lower. Okay. Just make note of that so I can know what area to examine. Okay. And the headaches, tell me more about those.
It's been happening for 3 months now.
Okay.
It's not a super intense pain, but it bothers me enough where I take medicine. It doesn't really make it better.
Okay. So moderate pain. Any time of day where it's the worst?
I would say dinner time.
Okay. In the evening. Do you consume caffeine at all?
Well, I do the TikTok trick, which is order a large McDonald's fry and chug a Diet Coke, which definitely does the trick, but that is not a very good long-term solution, I feel.
Well, we all have our things that help us throughout the day. I would say Diet Coke is less harmful than, say, coffee or tea if you're going to drink anything throughout the day. But just monitor that, because sometimes the caffeine withdrawals can be responsible for headaches, especially if you don't drink enough water throughout the day.
Yeah.
Okay. Do you drink a lot of water?
I try to.
Okay. Any changes to your diet or lifestyle?
No, not really.
Okay. Any other symptoms?
No.
Also, I want to ask, do you have a family history of migraines?
Yeah.
Okay. Is it on both sides of the family? Okay. All right. I'm going to start by taking your vitals. I'm going to do a cranial nerve exam just to rule out anything neurological. And then we'll move on to examining your scalp, your back, especially focusing on your back today.
Okay,
Thank you. Any questions?
I'm all good.
Okay, beautiful.
Thank you.
Okay. I'm going to start just by palpating the face. Just going to rule out signs of any lumps or bumps, contusions. Okay. So just relax. Go ahead and open and close your mouth gently. Beautiful. One more time. Okay. Now clicking or popping. I'm going to pull gently on the ears. Is this painful for you?
No.
Okay, pulling up. Is this painful?
No.
And down.
No.
Okay. Your post-irregular lymph nodes are non-palpable, and so are your pre-irregular lymph nodes. Okay. Go ahead and try to lift your eyebrows for me. I'm not going to let you do that. Very strong reaction. Go ahead and raise them for me. Your eyebrows. Good. Now try to lower them. Good. I know it's silly, but it's just to test your motor skills. Okay. Now try to turn your head to your left. Good. Turn your head to your right. Beautiful. Try to look up at the ceiling for me. I'm not going to let you do that with your whole head. Good. Now try to touch your chin to your chest. Excellent. All right. I'm going to just be doing some very gentle tapping, okay?
Okay.
Okay, go ahead and turn your head towards me. Good. Any pain when I do that?
No.
All right. Just feeling for edema. Okay, very good. Okay, next I'm just going to feel the back of your head. This is before I do your vitals. I just want to make sure that there's something going on with any kind of possible concussion because of your head issues. So just bear with me here. Palpating. Okay, any pain there?
No.
All right, I don't feel any sudden issues, okay? So it's probably some kind of lifestyle thing, but I'm going to check your vision and your hearing later on.
Okay.
For now, I'm going to listen to your heart and your lungs.
Okay.
So just breathe normally for me. Do you mind if I go underneath the shirt? Okay. Okay, your heart sounds perfectly healthy. Go ahead and listen on the bell side for murmurs. Wanting to hear S1 and S2 only. Good. Okay, right here on the heart. No S3 present, so that's really good. I'm just gonna write that down. Okay. And take your blood pressure. Do you mind if I raise your sleeve just a little bit?
Go ahead.
Okay. Perfect. That's not too tight, is it? Nope. Okay. Okay, 110/72, so that's very good. Very good. Just gonna go ahead and slide this off. Okay. Okay, I'm going to take some measurements of your face. If you could just face me just a little bit. Very good. I'm just going to judge for symmetry here. So just relax. Just going to go by centimeters, 19 and a half. 19 and a half, perfect. Okay. Going to just go from tip of the nose down, just to have our records. That's 12, and the crown of the skull to the tip, that's 19 and a half. And 19. Okay. Okay, just gonna measure the sides of the face. 27. 23. A little bit of deviation. Not out of the normal range. Okay. Go ahead and open your eyes. I'm going to go right underneath. That is 7 and a half. You have large eyes, and they are symmetrical. Okay, so I don't detect any signs of stroke or numbness of the face. Very good. Alright, go ahead and open your mouth for me. I'm just going to check. Look at your tonsils. Okay. They look very good. Your mouth looks very healthy. It's not overly dry. No signs of tooth decay. Very good. Okay. Stick out your tongue for me. We'll wiggle it from side to side. Okay, good. Did you have any difficulty doing that? No. Great. So now I want you to go ahead and look at this light. I want you to follow it with your eyes, okay? Ignore my fingers. Follow the light. Good. Now let me know when this light enters your field of vision. Say now.
No. No. No.
Okay, going to look inside your eye next. Okay, go ahead and look straight ahead for me. Okay, your pupils are round and reactive to light. I don't see any issues of jaundice, scarring, scratching. Your level of visible veins seems normal to me. Go ahead and look up for me. Look down. Look to your right and to your left. Good. Okay. Same here. The whites around the eyes are normal in color. Very healthy level of moisture. Go ahead and look up. Look down. To your right. To your left. Okay, straight ahead. Any problems doing that? No. Okay. Now I want you to take the Snellen chart. Hold that arm's length for me. Okay, good. Can you read this fourth row right here, beginning with the O?
O-L-C-F.
Great. And the row right beneath it, reading it backwards, beginning with the S?
S-B-J-H-D.
Beautiful. And that last row?
L-T-F-P-H.
Very good. Do you wear glasses or contacts?
No.
Okay. Wow. Impressive. What color is this to you?
Red.
What color is this?
Green.
Do you see this row of circles at the bottom? Yeah. Which is larger, 8 or 7?
8.
8 or 9?
9.
9 or 2?
9.
Okay. Look at me. Fixate on the tip of my nose. In your peripheral vision, which fingers are moving? The fingers on your left or your right?
Left. Right. Both. Left. Right. Both.
Excellent. Going to take your oxygenation now. Go ahead and give me your index finger. Just hold that. Okay, go ahead and rest it. Going to just write down the metrics. Your heart rate is 82 beats per minute, completely acceptable. Oxygenation is 98% of room air. You don't smoke or vape, do you?
No.
Very good. Going to just hold still. Okay, temperature is normal. No flu-like symptoms.
No.
Okay, perfect. All right, just going to do a couple sensory tests, okay? So here I have just water and a brush. I'm going to be either dripping some water lightly on your cheek or using a brush. Go ahead and say wet or dry depending on which one you feel, okay?
Okay.
All right.
Wet. Dry. Wet. Wet. Dry. Wet. Dry. Wet. Wet. Dry. Dry. Dry.
Good.
Wet. Dry. 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 Wet. 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 Dry. Dry. Dry.
Okay. Okay. This will be a sharp sensation, and this is dull. Let me know which one you feel, okay?
Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp.
Very good. I'm going to take a look inside your ears next.
Okay.
Have you had any hearing or hearing issues in the last year?
No.
Okay, that's good. Go ahead and look straight ahead. I'm just going to look right inside the ear canal, looking for that tympanic membrane. You literally have no wax, like none.
I just used my Q-tip today.
That's amazing. Whatever you're doing, I would encourage you to keep it up. Just be gentle with the Q-tips. Usually that's not a conventional method. But your tympanic membrane looks beautiful, oyster gray. No scarring or scratching. Looks like a very healthy ear canal. Okay, I'm just going to look at the outer ends of the auricle, making sure there's no bacteria buildup in the folds. Okay. Very healthy pores. And look behind the ear as well. Lovely. Okay, I'm going to look inside this ear. You have very pretty earrings on today.
Thank you.
Literally looks identical to the other ear.
Nice.
No issues, no wax, not even a hair. Are you an alien? Looks really healthy to me. Okay, just gonna check the outside of the ear. The folds. No, very healthy. Checking the outer auricle and right beneath, behind the ear. Healthy, no bacteria or fungus. Great. Okay. So close your eyes. Let me know which ear you hear in my wrestling, left or right.
Left. Right. Both.
Okay. I'm going to whisper some things in your ear. Just repeat what you hear after me. Summertime.
Summertime.
Boat ride.
Boat ride.
Flowers.
Flowers.
Celsius.
Celsius.
Dodecahedron.
Dodecahedron.
Yes. All right. I'm going to go to the other ear. Sunshine.
Sunshine.
Clouds.
Cloud.
Shih Tzu.
Shih Tzu.
And sweet potato.
Sweet potato.
Good. Very good. Okay. Just going to do a couple more tests. Okay. This is a tuning fork, so I'm going to place it very gently on the side of your face. You're going to hear it and feel the vibration. Let me know when both of those stop for you. They should stop at the same time.
Gotcha.
If not, let me know that as well.
Stop.
Good.
Stop. Stop.
Okay.
Stop.
Placing on the chin. Stop. Okay. This is the same test, just a different frequency.
Stop.
Good.
Stop. Stop.
Very good. Okay. And please tell me which sound is louder, A or B. A, B,
A.
A, B,
B.
A, B.
A.
Good. Okay. All right. So for the remainder of the exam, I'm going to have you lay down. I'm going to test your smell and taste, as well as a very brief abdominal exam, and then we'll really take a look at your back. Okay? Okay. First, we're going to be doing a smell test. Go ahead and inhale. Let me know what the scent is to you.
Eucalyptus.
That was orange. So very different. Okay. Go ahead, inhale. What does that smell like to you?
Is that for real eucalyptus?
No. You got eucalyptus on the brain.
Apparently, is it mint?
No. Sandalwood.
Oh.
Okay, having some problems here, but that's okay. That's what we're here for. This one should be pretty straightforward. Go ahead, inhale.
Vanilla.
It's rose.
Oh.
So that's also very wrong. We're going to do a few more. This one's difficult, so if you get something similar to it, I'll allow it.
Can I have a hint?
Well, it was one of the 3 things that was brought to the manger.
Myrrh?
No, frankincense. No. You're really striking out on these.
Apparently, I have issues I didn't even know existed.
Okay. This one is also very difficult, so I don't have high hopes. Go ahead and inhale.
Ocean breeze.
Correct.
Really?
Yes. That one. Okay, and this one is very basic, simple, shouldn't be a problem.
Vanilla.
Very good. So you had 2 out of 7. Definitely still not
Passable
good.
grade.
No. Under no rubric is that a passable grade. But we'll move on to a taste test just to see if your cranial nerves are compromised, or are you having stuffiness with the season? Allergies?
No.
Not at all. I was going to give you a pass. Okay.
Actually, maybe a little.
A little? Okay.
Yeah.
Very convincing. Okay. Okay. So testing strip, go ahead and open your mouth, close, and open. What does that taste like to you?
Nothing.
Okay, good. That was control paper. Okay. Okay, go ahead, open, close, open. What does it taste like to you?
Kind of like pine.
Okay, that was cotton candy.
Oh my god.
So, not quite right. We're gonna do one more. Okay, open, close, open. What did that taste like?
Like cinnamon.
Yes. Okay. Beautiful. So, just gonna do a quick scalp check. Just making sure that you don't have any lice, any issues with the scalp. Okay, just gonna look at this part here. Okay, no issues that I see here. Scalp looks healthy, no signs of dandruff, lice. Okay. Your hair looks healthy as well. Okay. Just going to take a sample of the skin just to make sure that the follicles are healthy. Okay. I do have just a little bit of spray and serum to apply to help with overall scalp health. Go ahead and close your eyes. Okay. Excellent. All right. Okay. Just going to check the area right above the ear, and then we can move on. Okay. I'm not seeing any dandruff. No abrasions here. So your headaches are definitely stemming from something internal. Okay, just going to do a quick sensory test along the side of the face. Okay, this is one pressure point. This will be two. Do you feel the difference?
Kinda.
Okay. Let me know if you feel one pressure point or two.
1, 2, 2, 2, 1, 1, 1, 2, 1, 1, 1, 2, 1, 2, 2, 2, 1, 1, 1, 1, 1, 2, 2, 2, 1, 2, 2, 2.
Okay, okay. All right, so next I'm going to just palpate the abdomen, and then we'll flip around and look at your back, okay?
Okay.
Right. So if you don't mind, I'm just going to lift the shirt and lower your pants just a little bit so I can have access to the abdomen. Okay, I'm just going to palpate. Let me know if you feel any pain. Any stomach issues?
No.
Digestion problems?
I just had a pizza though, so
Okay.
it might be some digestion.
No, that's temporary. I'm going a little bit lower to palpate the lymph nodes. Feel very healthy. Okay, so I'm just going to listen with my stethoscope, but your organs all feel and sound healthy to me so far. No abnormal regurgitation sounds or acidity. Okay, excellent. So next I'm going to have you get in a hospital gown. We're going to put a wedge pillow up here and I'm going to examine your back and see what kind of treatment I can apply. Okay. So I'm just going to start by listening to the back. Take a deep breath in for me and out. Okay, deep breath in and out. Okay, sounds normal to me. I'm going to just take your temperature along certain points of the back. A little elevated. Okay. Okay, just slightly elevated. I am feeling this knotting in the center. Okay. The skin looks very healthy and well perfused. I just see some normal blemishes. No acne. No moles, just a couple cherry angiomas. They are harmless. Do you feel this puff of air on the right or left side of your back?
Right. Right. Right.
Okay. With your permission, I'm just going to do a bit of suction therapy. Just focus on that center of the back. I'm just noticing a lot of tension there, which could lead to a medical problem if not addressed, okay? Okay. Just redistributing the center of muscle tension and aiding in detoxification as well as smoothing of the muscle mass. Okay. Going to add just a bit of foaming lotion. And smoothing that in.
So sorry.
Let me know if it gets to be too intense. It's very therapeutic lotion. Okay. Just going to do a little bit more cupping. This is just to help alleviate the pain without taking those over-the-counter medications. We're really focusing on the lower center back. Just remember to breathe. A lot of the tension that we have can be held in uneven breaths. So, in addition to oxygenating the skin, applying plenty of oxygen to the lungs and remembering to breathe deeply can really help with fibromyalgia-related aches and pains. Okay. 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 How does that feel?
So nice and relaxing.
I'm so glad. Okay. So I'm going to give you a follow-up call in a few days just to ask how the back pain is. In terms of your head pain, I would give that just a few more weeks, drinking plenty of water. If it worsens, definitely call me and we can do some further testing and imaging. But your health insurance isn't that great. So, you know, I don't want to order all these tests and, you know, put you in the hole.
Thank you for that.
Put you on the street unless I have to, okay?
Mm-hmm.
Okay. Okay.
Thank you, Deb.
Oh, you're welcome. All right. Well, have a relaxing day, okay?
Thank you.
All right.
Bye-bye.
Bye-bye.